Hello, I'm Dr. Bruce Grossman, gastroenterologist on staff at the Longmont Clinic, and I was asked to speak to you today about some risk factors as well as some basic principles in colorectal cancer disease and prevention. First, colorectal cancer is the second leading cause of cancer deaths in the United States. Men and women are at equal risk of developing the tumor. Early detection of colorectal cancer leads to easier treatments and higher survival rates. More than 1/3 of colorectal cancer deaths could be avoided if people are properly screened and regularly monitored, and colorectal cancer screening is safe and effective. So what are the symptoms of colorectal cancer? It may begin with absolutely no symptoms, but the more common symptoms and warning signs are rectal bleeding, blood in the stool, which could be of any type of color, bright red, black, or very dark, a temporary change in the bowel habits or stool shape, including pencil-thin stools, discomfort in having a bowel movement with absolute urges, cramping in the lower abdomen, frequent gas pains, unexplained weight loss, and constant fatigue. So who do we screen and when do we screen for colorectal cancer? Colonoscopy is the screening test of choice, and the test is recommended starting at age 50 for average risk individuals and recommended every 10 years thereafter, unless polyps are found. Patients with higher risk for colorectal cancer, including those with family history or polyposis syndromes, should talk to your gastroenterologist about appropriate screening intervals.
Hi, I'm Nuzhat Iqbal. I'm a gastroenterologist at the Longmont Clinic, and I'm going to talk to you today about colon cancer screening. Colon cancer is a leading cause of cancer in the US, and it is the third leading cause of cancer in both men and women in the US. A very effective way of screening for colon cancer is by doing a test called colonoscopy, which is performed using a fiber optic endoscope that has a light and camera at its end. It allows us to visualize effectively the entire colon. At the time of colonoscopy, we are looking for presence of abnormal growths in the colon, including polyps. These polyps are usually precancerous and can turn into cancer if left inside the colon. They can be removed by putting a wire loop typically around the growth and then putting electric current through it, which allows for the growth to be cut off, and then it is sent for testing. The procedure is safe if done carefully and with diligence.
If you have any of these problems or symptoms, I suggest you speak to your primary medical doctor to see whether any further evaluation is necessary.